just two. So if the very first persons that had the blessing, that had instruction, did not have that many, and they lived for donkey years, I mean, hundreds of years, then where, where are we coming to think that we are fulfilling that, in quote, instruction as individuals alone? Now, that brings me to a point that is very, very important. Quickly, it was in 1484 that the then Pope issued an edict, so to say, against infanticide. And in fact, the word they used was slain infants yet in the mother's womb. Slain infants yet in the mother's womb. As of that time, there was no system, there was no method of family planning that addressed anything about a baby that was in the womb. The only thing they had was majorly coitus interruptus, withdrawal method. The few that were trying one thing or the other were trying something that they used to barrier method. So that tells you where the myths started from. So a lot of these were unfounded, not based on scriptures, but based on this is what we think. Now, again, people, like I said at the beginning, people use that Genesis 38:9 or 9, spilling the state, as the way God hates family planning. No, God was against what he was doing because he didn't want to raise a seed for his brother. That was what God was against, not spacing the family, not planning the family that you want to have. The same God has said that a man is worse than an infidel if he cannot take care of his own family. It's in the same God. So that means the man should think from where I am, how many can I look after? Now, that, yes, it's not saying that you shouldn't have faith in God for your economy, but it also means you should plan. So faith and planning go together. The evidence of your faith actually is seen in your planning, in your practicality. So as far as I'm concerned, as from the scripture, there's nothing in the scriptures that says that God is against a man planning how many children he wants to have. As I said before, Joseph had only 2 children. And there was nothing that suggests that Joseph had fertility problems. So that meant they planned. That meant they planned. They planned, this is how many we're going to have. And they put a stop to it. Whether because they were in foreign land or not, but he was a wealthy, very wealthy man. So it wasn't finances that was the issue. So God is not against planning. And I will say that again. The Bible did not say God is against planning. And the Bible did not instruct that it's only one person that's going to populate the earth. No, it is for every one of us. So I hope I've answered some of that.
Very well, sir. Thank you so much, sir. So you've heard it from Pastor Dr. Dayowe. God did not give you it's not only you that was given the mandate to populate. I think that is what I would tell my grandmother. Another time that she brings it up, I'm like, no, this mandate is not for only me. It's for everyone. So you just have to take your own aspect, I bring my children, you bring yours, and then combine, we will populate the earth. Thank you so much, Pastor Dr. Dayowe, for that awesome answer.
Thank you, sir. Last but not least, I would like to ask Dr. Adeniyi a question. How can a couple discern whether the specific birth control to use? For example, do you need to try out many birth control pills, method before you finally find the one that suits you best? As a woman now. Over to you, sir. Or does it mean doing all the tests and then we know, okay, this is the best one for you? Or can we try one now and realize that, oh no, this doesn't work for you, so you need to try so many things out before you finally get the best birth control method to use, sir?
Okay, as previously said, you don't have to try many options, okay? you have to look at what are the options that are suited for you and for your spouse as a couple, and look at the ones that you can abide with, follow the instruction and all that. Certainly, you may start with one sometimes, and you may have some side effects like Dr. Ojo mentioned. Most of the time, these side effects are transient and will leave, where a number of people, based on hearsay, may say, they'll just stop and all that, and then go on to another one. Well, you don't have to keep trying everything. Just look at, based on your priorities, based on what you have decided, based on your health situation and circumstance, your risk factors, your age, and all those bits. You can narrow down the options. Okay, you can narrow down the options of what you can use, and then from there, talking to your healthcare provider, you can decide on using one. As long as that one is fine and it's okay with you, you don't have to change. So if, for example, you started out with an IUCD, it was okay with you, you removed it to get pregnant. After the delivery, you can go back to the IUCD. You don't have to try and test all the options. Okay, so you narrow down the list based on your circumstance, your decisions, and and all that, and then you decide on one. And if that one works well, that you can maintain, and you can keep using that. Of course, if you had tried the permanent method, there's no other option after that.
Thank you so much, sir, for that. I think we've finally come to the end of for this, but then we have so many questions, and we'll start taking them one after the other. Over to you.
Thank you so much. And yes, we have so many questions. We have 10 right now that we will take, and then we'll see if other comes up. And the first question that we have is, how do we balance the fact that family planning isn't abortion and moral standing of chastity? Okay. And this is the question now, and I will direct this question to Pastor Dr. Dayowe. Is the use of post pills by unmarried partners living together considered as a family planning ethnically? And then the second aspect of that question is like, would a Christian that fall into fornication and use emergency pill or post-nup committed abortion? Okay, so I'll repeat the question again, sir. Is the use of post pills by unmarried partners living together considered a family planning? And would a Christian that fall into fornication and use emergency pill committed abortion or family planning?
So the first thing to say is that post pills is not abortion. That is post sex exposure pills. It's not abortion. So that settles that, number one, because there is no baby that has taken place to kill. Okay, that's number one. The second part of it is, now going back to question number one, there's nothing ethically right between people living together that are not married. Whether they have sex and it becomes a pregnancy or not, does not make it right. It is still wrong. Wrong is wrong. That somebody falls pregnant or not does not make it right or wrong. It is living together without being married that is wrong in the first instance. But post-emergency pills itself, scientifically, is not an abortion. That's what I'm trying to emphasize. But at the same time, the couple living together that are not married the first step is simple relationship. So there's no chastity in that one. Couples now marry using emergency pill. It is not abortion, but they should plan better because it's not as effective, especially as the days go by.
Awesome. Thank you, sir. Thank you. I hope the person that hears the question, you've heard it correctly from Pastor. Okay.
I would like to ask Dr. Anu this question. Can any choice of family planning cause painful penetration?
sorry, I'm supposed to answer that, right?
Yes, ma'am.
Okay, so ideally, it shouldn't. Okay, although I've come across one or two patients who said after they started using an IUCD, okay, that their husband started complaining that he's feeling something poking him and things like that. So ideally, if the IUCD was properly placed in the uterus, of course, usually there's a string that is attached, and then for when you want to remove it at some other time and all that. But ideally, it shouldn't. So if anybody's having that kind of experience, they should go back to their doctor, their service provider. Possibly, it's possible for an IUCD to be displaced. Do you understand? Ideally, it should be within the uterine cavity, probably poor technique, and then for some other reason, it's not just properly placed and is already dislodged. Sometimes it can dislodge inferiorly into the cervix. So some people dislodge it so bad it gets into the peritoneal cavity. I mean, away from the uterus inside the abdominal cavity. Okay, so if ideally it should not, but if anybody has that kind of symptom or complaint, that they need to go check the IUCD they put in situ. Is this still where it should be, or it has been displaced, or something is wrong with it, and then it's giving their partner or their husband that kind of funny feeling, okay? Or sometimes, I hope it's not just something in their head that they feel because something is there, they really have to feel that something is there. You understand? So the objective way to be sure is to go check. Usually we do an ultrasound, to see if it's in the uterus. If you can't find it in the uterus, you may move on to do an X-ray. You understand? Because most time it has a copper, so it's metallic, so you can see it. Okay, so ideally should not. But if for any reason a partner, a husband is having that feeling, then they should go back to their service provider, their doctor, to get it checked out to make sure that the IUCD is where it should be and it has not been displaced. Thank you.
Thank you, ma'am.
Thank you, Ma. And then we have another question that I would like to ask Dr. Ayola Ojo. And this question is, so this person said she had an implantation for some years and then noticed that the menstruation ceased ever since this implantation. Some months they will experience some spotting, and also some other months nothing comes at all. Apart from this, she does not also experience any other side effects or except the spotting that comes some months and not. And then she's wondering whether to be worried about the seizure of her menstruation. Are there side effects of this that come with aging? Anything to expect in the future, especially post-menopause?
Okay, thank you very much, Ma. Okay, what we call is it amenorrhea now, as an absence of menstruation, is one of the side effects that we can expect from hormonal contraception. And I guess one of the reasons why this person may be asking that question is this: there is this belief that once you are not menstruating, you are retaining some dirty substances that ideally should be flushed out through the menses, in your body, and that, can, give you some health challenges, but really there is nothing like that. So whether, it's pre or even after menopause, but after menopause, I don't think anybody even has a reason to be using hormonal contraceptives. But even before menopause, there is no risk as it is or as it were associated with, either scanty or even absent menstruation for somebody who is on hormonal contraceptives. Thank you very much.
Thank you very much, Ma.
Thank you, ma'am. I would like to ask Dr. Adini this question, sir. Someone is asking, is there any side effect that can cause a woman, that can cause a long-lasting negative effect on a woman? Also, although you already, this has already been mentioned during the course of this meeting, someone's asking how to check, like, is there a medical way for a woman to check which method is best suitable for her, both for effectiveness and avoidance of any side effect? Over to you, sir.
It seems we lost Dr. Adeni.
Okay.
I think he logged off. Oh, yeah.
Okay, Dr. Torres, you can answer the question. I don't know. Would you like me to repeat the question again, ma'am?
Yes, please do.
Okay, ma. So someone is asking, is there a medical way for a woman to check which method is best suitable for her, both for effectiveness and avoidance of any side effects? And also, is there any side effect that can cause a lasting negative effect?
Thank you very much for that question. So the best way to know what options work for you, what your options are, and what is best suited for you is to go to a standard place where they offer family planning services. You understand? Irrespective of your location globally. Don't take counsels or advice from the streets, your friends, one ramshackle clinic somewhere. You understand? Go to a place where you can have standard care. When a holistic approach I'm taking, that's the best way to know what will suit you, what your risks are by virtue of your personal or family history. So it's not a guess, as it were. You understand? So you see a medical professional, they talk to you, they take your history, you interact with them, they ask you personal questions about you yourself, your health, they ask you questions about your family, history of diseases in your family. They do other things like taking your weight. Are you hypertensive? Are you diabetic? All those information will come into play to determine what works best for you. You understand? So that's the best way. And that's why I said it's important to go to a place where you are sure of the care you're going to have access to, where care is standardized to get access, to a good medical care. So that's the best way to know, okay, what family method planning will suit you. You understand? Taking that holistic approach. That's the best way. It's not by guessing, or my friend is using this, I also want to use it. Okay, and like Dr. Martini said, if for some reason you now use something and it doesn't work out, then of course you can look at other options. Or you were using a method, was working well, you took it out, you got pregnant, you had another. Of course, you can go back to that same method, okay? And of course, it can be reviewed. If somebody is doing well on a certain plan, and then for some reason, risk factors come up. So she wasn't hypertensive before. Now she's hypertensive. You may need to review that decision. And then the second question on the best way of avoiding risk and all that. Of course, same holistic approach, but once somebody reaches menopause, there's no reason to be on any contraception again. So if you have any contraceptive device, whether an implant, an IUCD, of course, all that you can take out if you're not particularly very comfortable with it once you are perimenopausal or you reach menopause. But ideally, you minimize risk by taking an informed decision from a qualified health professional. Thank you.
Amazing. Thank you, Ma. And then I think the last time Dr. Adeni went offline, and okay, now I will ask this question from Pastor Dr. Dayoweye then. So the question goes like, I would like to know if using contraceptive, not condom, as a newly married woman who is not ready to start having kids immediately after wedding have any side effects. So a lot of people will say it would cause a lot of irregularities which can set conception when she's ready to start having kids.
Okay, so again, the answer goes back to the same that we just had from the last speaker and many more, that each person is different. So there's no one quote fits all kind of thing when it comes to family planning. Whether in this case the person is obviously a woman, is thinking maybe or hormonal contraceptives or whatever. Number one, the family must talk together. What's their plan? Number two, the persons that are going for, obviously in this case is the woman that is going for contraception, must be examined, have a history done to know what suits her and the family best in their particular position. Number one, our own health and the family together. It's not everybody that wants to have a child within the first year. That's true, because the circumstances may differ at that point in time. But what is the best method? That cannot, I can't give you a specific because I don't know who you are. You see, I don't know your background, I don't know what your history, I don't know how old you are, I don't know what other medical problems or conditions you have. So that needs to be addressed by a healthcare provider that knows how to do the talking and the examination to be able to say, okay, this is what is best for you at this point in time. Because that person may want to be pregnant in 2 years' time. So maybe an IUD is not the best. Maybe an implantation is not the best. But what other health conditions does this person have? So that's where it is so much of a specific thing that they need that advice, depending on who they are. So I can't give you, oh yeah, this is the
Thank
best
you
fit
so
for you.
much,
No,
sir,
no, no,
for
no.
that.
It doesn't work that way.
Thank you, sir.
Thank you, sir. Thank you for that. I would like to ask a question now to Dr. Ayola Ojo. Someone is asking, okay, family planning, apart from when and when not to have kids, the myth about vasectomy, for example, family planning is not about, doesn't cause infertility. Someone is asking a question. Okay, so the health consequences as well. So what else does family planning focus on?
Okay. Thank you very much. If I get the question right, no, family planning is about taking a decision on the number of children that you want to have and then adequately spacing them. So maybe this person is trying to ask for maybe non-contraceptive uses of or non-contraceptive benefits of family planning methods. Of course, you know that for our hormonal, contraceptive methods, we have other benefits, other advantages from them, such as number one, in the treatment of certain conditions. For example, sutism, when a female has hair distribution in a female pattern. So hormonal contraceptives are used, to, treat such, a condition. And then also for women who have a condition where the ovaries have cysts, polycystic ovarian syndrome, and of course it has its own diagnostic criteria. Hormonal contraception can be used to regularize the menstruation. And in fact, it's been known, hormonal contraception has been known to actually improve fertility in them. We have talked on this so much in the course of this, discourse, that contraceptive use does not predispose to infertility. Then for patients also who have yes, some maybe progestogen only can predispose to excessive pimples, but combined oral contraceptive pills can also actually be used in people who have excessive pimples. Also, for those who have heavy bleeding, menorrhagia, there are, types of hormonal contraception that can help, to, correct that, as it were. And ditto for people who have a painful menstruation. Thank you very much.
Thank you.
Thank you very much, Ma. And we still ask one question from you, Dr. Ayola Ojo. And the question is, can somebody who is fighting high blood pressure do family planning? And what type of family planning is best for such a person?
Okay, thank you very much for that question. Now, in the course of our interaction, we've made mention of quite a number of things, that the choice of family planning methods depends on a number of factors. One, the age of the patient. Two, the desire to have children in the future. Three, maybe the personal and or family history of certain diseases and all that. So if, I mean, after the assessment, it's only hypertension that the patient has, and let's note, you know, for hormonal contraceptive can actually, one of the risks is I can induce hypertension, and in those who already have hypertension, it can, you know, make their hypertension, I mean, more difficult to treat. You understand? So if, I mean, the only thing after history examination and, I mean, investigation, the only thing is hypertension. So such an individual may not, because there may still be a reason to go for hormonal contraceptive. After all, somebody can take a decision that, okay, this your hypertension is mild, you can use medications to control it. I hope, I mean, we got that. But if we don't want to now use hormonal contraception because of hypertension, then there are, I mean, other methods. We have, I mean, the maybe copper intrauterine contraceptive device. I mean, that person may not use the hormonal, I mean, IUD. Then, I mean, we have barrier methods. So by and large, those are some of the options. And of course, if the individual has completed her family, she can go for tubal ligation. If the husband is disposed to that, can go for vasectomy. Thank you very much.
Amazing. Thank you so much, Ma. I think that was very clear. Thank you for that insight. And yes, we've come to the end of the question and answer. It's been a very packed discussion today. But before we release our panelists, we want to hear from them still. But thank you so much for everyone that has joined us. If you look in the chat, there's a feedback form that is being shared from the OADI team. Please, we want to hear back from you. We want to hear what can be done better. We want to hear how this, section, how it felt for you. So please take some time. It's a very simple form, and fill out the form and let us hear from you right now. So we still have our Dr. Adeni having a technical challenges to join us. But it would be joining us without the camera and still be speaking. So we have him back. Nice. And for us to just wrap up, I just want the panelists to please tell us one critical thing. Like you've answered so many questions. You've poured out your, expertise, your heart out into this discussion, and we are very much appreciative of that. So, but if you have one key learnings, especially with the type of questions that were coming from people, but also from the team, if there is one key message that you want someone to take home from this discussion, what would be it? And I think right now the first person on my list would be Dr. Ayola Ojo.
So thank you very much. There are two things that I want to say. Number one, there are many different methods of family planning, but not all types are suitable in all situations. The type of family planning method you will adopt, will depend on your age, the desire to have more children in the future, personal and family history of certain medical conditions. And my advice is that people should visit an appropriate healthcare provider to help them with the choice of family planning method. Thank you very much.
Amazing. Thank you so much, Ma. Very very deep and simple. And then let's hear from you, sir, Pastor Dr. Dayo Owe.
Okay, I think I'm going to say the same thing I've said at the beginning of my talk. What family planning is not. And especially to Christians, so that they do not have a sense of guilt. Family planning is not abortion. Very clearly not abortion. The methods are not to disrupt a pregnancy that has already taken place. No, they prevent pregnancies. There's a clear difference between the two. So that is probably the most important thing I want to say at this point in time. So there's nothing in the scriptures that suggests that God is against family planning.
Amazing. Thank you so much, sir. And then, like I said, that is also very concise and straight to the point, and you've heard it all. Family planning is not an abortion. We have another question that came in, and we'll ask Dr. Adeniyi. So we didn't lost him, we have him back. So we'll ask him this question, and then he's also going to wrap up from his own key points. And the question is this, sir, does ICD causes vaginal cancer when not removed at the due date or expire? So what are the diseases that are associated with copper intrauterine cervical device when it expires in your vagina or when it lapses more than the year given? I believe you understand the question more than I do, sir.
Yes, I do. And I want to apologize again for the technical challenges I've had. Still trying to solve it. But I'll go straight to the question. One, it's called intrauterine copper device, okay, and is inserted into the uterus, not to the vagina. There's no evidence that suggests that it's been in place for a long time causes cancer. There's no evidence whatsoever to that effect. And even though we say that it's licensed for about 5, 7 to 10 years, there are reports of people that have left it in place for as much as 20 years. It's more like they just forgot that it was there. We've seen people that they were in their old age, they was trying to do surgery for some other things that we noticed that they had the IUCD in place. So it does not have, there are no documented challenges or medical problems with IUCD, even if it is left in place. Of course, that does not mean that it should be left beyond the time that is recommended. I was talking about infection. The only time that there may be a risk of an increased risk of infection is during insertion, and if that is not done correctly, done by an appropriate trained personnel using appropriate aseptic, infection prevention protocols, that's when there's a risk of infection. But once this is taken care of, the procedure is done correctly as it should be done, then there are no increased risk of specific infection, vaginal infection with the IUCD. And in wrapping up, one of the things I would just like to say that the risk of an unintended pregnancy far outweighs whatever risk that we may think of going for family planning or using any form of contraception. And don't choose your method based on what you have heard. And we should not we should be wary of what we see on social media. Most of the things that people talk about are the negatives, not the positive dimension of these things. So we should be careful. Talk to your healthcare provider and follow experts' advice. Thank you very much.
Amazing. Thank you so much, sir.
Thank you, sir. To Dr. Tojo, what would be your take home to everyone who has joined the meeting tonight, ma'am?
All right, thank you very much. So my parting words will be, we've heard a lot, you understand, but everybody needs to go back and at least this symposium, this meeting has cured some ignorance to a large extent, but everybody should also still go back to make sure that the ignorance is totally dealt with and all that. So in parting, I would like to say, Pastor mentioned it, faith and planning, faith and work go together. Okay, the Bible says in Proverbs chapter 6, go to the ants. That's what I learn that before winter, it makes plans and all that. So it's folly to just keep hoping and dreaming without putting practical steps in place, to plan adequately as a family, whether as a mother or as a father and all that. And then to talk about the abortion thing, like Pastor said, a baby has not been formed. Contraception prevents ovulation, different things, just so that a baby will not be formed. So if a baby is not formed, you can't be talking about abortion. So fundamentally, that is why contraception is not an abortion, because our been issue, a baby has not been formed. For you to say abortion has taken place, a baby was formed and then the baby was killed or taken out. You understand? But fundamentally with contraception prevents a baby from forming. So all in all, then you can't be talking about abortion if a baby has not been formed. And the Bible also tells us, 1 Timothy 5:8, if a man does not take care of his family, it's actually worse than an infidel. So wisdom is profitable to direct. I hope everyone will make the most of all they've learned tonight. Thank you very much for the opportunity.
Amazing. Thank you, Ma. Wow, awesome. We've come to the end of this packed and loaded discussion, and I want to see our panelists on the screen because we want to give you our heartfelt thanks. Thank you so much. We deeply appreciate you, Pastor Dr. Ayoweye. Thank you so much, Dr. Ayola Ojo. Thank you so much, Dr. Anolu Akwoto-Ojo. Thank you so much, Dr. Adeni. You've it was just amazing. I personally have learned a lot, and I think I've also learned so many things that I can say as a response to people that talk about these things. As a young lady, being in the midst of people that talk about these things, I know what to say. So thank you so much. We wouldn't have been able to do this without you. And on behalf of the OADI team, on behalf of our CEO, Ms. Peace Areogun, we say a very big thank you for honoring our call and for being here to answer our questions. And for everyone attending, we have just one last ask from you. Please don't forget to fill in the feedback form and let us know what you think. It will help us to improve. And lastly, last but not the least, don't forget that you can reach out to us at OADI Initiative. So like I said, all of this program, Intersection of Faith and Medicine, is uploaded on our YouTube. You can go to there, OOAD Initiative, and check it out. You can also visit our website at OOAreogun.dev, that's DEV initiative.org, to explore what OADI is all about. Somebody asked in the question, how do you volunteer with us? You can contact us via the website. You can write an email at admin@ooareogun.devinitiative.org, and we'll be able to answer you. So thank you so much again. Till next time, where we come on your screen with another amazing topic on intercession of faith and medicine. It's a bye for now, and enjoy the rest of your day. Bye, everyone.
Bye.
The